Welcome, everyone. My name is Alberto Diaz-Calleros. I'm the director of the Center for Latin American Studies, a senior fellow at the Freeman Spogli Institute of Stanford University, and a faculty affiliate at the King Center on Global Development. Today, we are continuing a series on COVID-19. It is going to be about the impact in Latin America. We have had sessions on China, on India. We will have a session on Africa as well. But today we are joined by a distinguished group of scholars who have been really thinking very hard about some of the issues that many of you must be concerned about regarding the evolution of the epidemic in Latin America. Let me tell you a couple of words about the King Center on Global Development. The mission of the center is to serve in improving the lives of the world's poor by enabling research on critical development issues and informing public policy. It has affiliates from across the university, with a large percentage of them coming from the social sciences and the humanities, economics and political science being some of the most prominent fields. So it is a multidisciplinary center that has many initiatives trying to support faculty and emerging scholars thinking about problems of development. The Center for Latin American Studies is also one of the co-sponsors of this event. It serves as a multidisciplinary platform to enable learning from and engaging with the Americas, understood as this wide and diverse ethnic, linguistic, cultural, and biological space with a shared geography that includes also the United States and Canada. It is a Title VI National Research Center, and it also has affiliated faculty members from across the university. I will provide, in terms of the mechanics of our meeting, some very brief introductory comments just to then give space for our presenters. They will make very brief presentations, and then we will try to keep as much as possible a Q&A set of discussions during the remaining of the hour. So if we want to understand a little bit the situation of COVID in Latin America today, obviously many of you must know that it currently has about 25% of the cases around the world. There is a sense that the economic slowdown of the Latin American region, at least some estimates put it at around 7 or 8%. It varies by country. We see on the left the cumulative confirmed cases. Of course, the United States is above in the chart, but Brazil is inching in, every day. Mexico also has an enormous amount of cases by now, and Colombia and Argentina, which are going to be some of the countries we're going to be talking about, are also quite, you can see that there is nothing there in those graphs that looks like a flattening of the curve or a plateau. When you think about the deaths, I'm showing you the deaths from our world in data visualizations, but if you think about the deaths per million inhabitants in a more kind of standardized manner, of course, you see Brazil, Mexico, and Colombia with very worryingly high levels of per capita mortality. This is not the case fatality ratio, so it does not depend on the prevalence of testing. It is really the actual deaths, at least as much as we can measure them as confirmed deaths from COVID. It does not include all the potential excess mortality. Argentina is also worryingly increasing, as you can see, despite all its efforts to contain and to, in some ways, keep the epidemic at bay. An important thing I want to highlight now is the sense that it is not that Latin America did not take concrete actions to try to contain the epidemic. So using, there's various indicators we could think of, but if we just move to the next slide and think about the way in which COVID impacted the world, we can see this is again from the same source, that as months went by, April, May, June, July, Latin America is just as stringent in terms of the kinds of measures that were taken in closing schools, in reducing the mobility of people, It is, of course, you see those yellow areas there, which are Uruguay and Nicaragua. Those are the exceptions. But in general, Latin America remains relatively closed with enormous social and economic impacts from this reduction in mobility. And today we have three people who really have been thinking very hard about these problems. Let me introduce them very briefly. I will not really give you a very detailed bios of them. Julio Croda is the former Julio Croda is the former chief of the Department of Communicable Diseases at the Secretary of Health Surveillance in Brazil. He is also associate professor at the Faculty of Medicine of the Federal University of Mato Grosso do Sul, and also one of the researchers of the exemplar of the prime institution of Fiocruz in Brazil, which is one of the biggest epidemiological institutions in the world. Marcela Eslava is professor of economics from the Universidad de los Andes in Colombia, in Bogotá. We are also joined by Nora Lustig, who is the Samuel Z. Stone Professor of Latin American Economics and Director of the Commitment to Equity Institute, CEQ, at Tulane University. So we will proceed in the order that we have right now. So I will start by asking Julio to share with us a few minutes of his reflections on what he has been observing and analyzing regarding the evolution of the epidemic. Julio, please go ahead.
Thanks, Albert, to the inviting. I think it's very nice to be here with the Stanford audience. I have a close work with Jason Andrews from medical department, and I show some slides. It's only to reflect about the history that occur in special cities in the north of Brazil. I begin with this picture from Manaus Cemetery during the COVID-19 pandemic. This is the worst day that they have a lot of toys in this cemetery, and the majority go to in this way, like it didn't have any familiar involved in this, and it's very, very impacting image, and it's a tragic story. Here is some data about the number of the deaths that occur in Brazil, especially focus on different regions in Brazil. Brazil is a big country, and you have a huge impact in the north. And it's very nice to see the curve in the north that reach this 200 deaths per day, and after that decrease very sharply. Different of other regions like the southeast, São Paulo, Rio de Janeiro, the big cities, that is like a plateau, and the Middle East and the South that begin the epidemic curve now. And in Brazil, if you look at the deaths, you can see a plateau for more than 60 days. It's close to 1,000 deaths per day. And especially in the north, when you put in the context in the north, you have in this region more than 500 deaths per million. It's very expressive numbers. And when you look the city, the capital of Amazonas, Manaus, and you look the excess of death is not only related to the COVID. The COVID, it's make a great impact, but you have a lot of deaths that is not related to the COVID. And this graph show very good this idea that during the past, this is the median of deaths in these cities, 4 deaths per day. And after and during the COVID pandemic, this go until 106. It's a huge impact. It's like a natural history that occur in this special city. And in this city, in the majority of Brazilian city, you have the government tried to push for social distance, but didn't have a good, the population don't have a good adherence in this social distance. the majority of the city become between 40% and 50%. And you have all this law to put the people inside the houses, but the truth, the people continue to work, continue to go out, and your RO, it's very high. It's 3.1. It just published in the Nature Behavior, and show that in Brazil the RO it's high than other countries like France, Italy, and Spain, and UK. And you can look in the state. You have some difference among the state, and Amazonas, it's the high state with a high transmission that according is specific in this state that Manaus is the capital. Here you can see during the time, Manaus, it's reopened the economy since the beginning of June. And since then, it didn't have a second wave. I show the curves of the north that decrease in the number of deaths. And in the last 60 days, the reproductive number is continuing to be below 1 without social distance. And what occurs in these special cities? You can see here the evaluation of reproductive number. You can see the evaluation about the cases, the decrease of the case, and the deaths. Maybe you have an immunity in this special state and this special city with this tragedy. The concept about herd immunity is about 60% is based in the reproductive number, but you have some new data that show maybe can be below of this, especially because the heterogeneity among the population, genetic factors, prevalent immunity, and maybe it's related to preventive measures that population can be taken. Maybe this can be 20, 40%. And you have a good study that performed in the entire Brazil. It's a soil survey. When you look the serial soil survey that occur in this special region of Brazil, the first region have the peak of the disease, we have this excess of death. You have some cities that reach 20%, 25%. And this can learn to the world what occur in Brazil. It's a tragedy. You lost a lot of lives that don't have opportunity to have a health care. But now you can see some impact about related to this tragedy. Maybe you reach the herd immunity, especially in Manaus City, and you can learn with this during the time. Thanks, Albert, for the opportunity, and I can answer the questions in the end.
Thank you, Julio, and thank you for keeping on this very strict schedule as we think of a few minutes, but we'll have more time for further discussion. Now I will ask Marcela to share with us some of her thoughts on the situation in Colombia.
Thank you very much, Alberto, for the invitation. It is a pleasure and an honor to be here. Let me indeed share some thoughts. I hope they are also illustrative of more broadly what I think is the Latin America situation and what respects to the possible impact of the emergency on the economy and the path forward. So I want to start by thinking of what are the mechanisms by which the economy is impacted. And I think it's important to have in mind that what you have here is a storm in the sense of having several shocks hitting at the same time. On one hand, you have what I would call an idiosyncratic or sectoral demand shock, whereby some sectors are affected in the demand they see because of fear and caution that change the behavior of people and therefore the demand for certain services and goods. If you think of restaurants, of hotels, of massive events that people will be avoiding, the average person would be avoiding, that's the kind of thing that I have in mind. Then on the other hand, you also have supply shocks. You will have lockdowns, of course, that will affect especially non-essential sectors. But there are also other characteristics of the technology, whereas the occupations that people are in require high physical contact, whether they allow people to work from home or not. Those are also determinants of how things impact on businesses and on jobs. Both sources of shocks, as well as external shocks that I'm not going to talk about today, are amplified through two different mechanisms. One is the input-output linkages that implied that not only a business is hit, but when it is hit, then its customers and providers are also affected. And there's also amplification through aggregate demand. That is to say, if a person is, say, in a non-essential sector, his or her job is shut down, he or she loses income, then that person is going to reduce his or her demand for all of the goods that are normally demanded, and that's going to expand through the economy. And so based on that sort of basic framework in work that I'm conducting with Laura Alfaro and my colleague Oscar Becerra, we're trying to look at how is the differential and whether there is differential exposure of a typical Latin American economy as compared to, say, more advanced economies. And our argument is that there are several reasons to believe that some of these shocks may hit harder economies such as ours. One has to do with informality, people who live on basically a hand-to-mouth kind of environment where they produce their living every day. And when they face a lockdown or an economy where people are not going out, their incomes are being hardly affected. There's also other reasons why informality worsens the situation. For instance, related to the fact that these people are not insured by their employers. They may lose their jobs immediately because there's no employer that they're tied to and that the law obliges them that employer to keep that person in the job. Firm size also matters, and it turns out that Latin America has a firm size composition much more tilted towards tiny businesses. And it turns out that tiny businesses have a harder time dealing with the shocks because they have less cash that allows them to continue paying workers and paying the rent and paying their materials, etc., when they're not having a new income. Then there's also the fact that the occupational structure is also more tilted towards less sophisticated jobs that are harder to perform from home. And on top of all of that, we tend to have labor regulations and market regulations that allow for little flexibility. So adapting is very hard. And also, for instance, having people that go out of a job and then into the social security system so that their employers don't have to continue paying them, that's not possible under these very stringent rules. So with all of that in hand, if you look at this chart, we're just trying to show how much more complicated is this situation. This is Colombia versus the US as an example. I have here Colombia, by these measures of informality, have 60% of people on informality. Other measures will give you something like 50%. I don't have a number for the US because that's not even measured in a systematic way. That's not an issue. People who are self-employed are over 40% in Colombia versus less than 15% in the US. The number of people, the proportion of people on a job that are in a firm that is less than 10 employees, including the self-employed, is over 70% compared to less than 20% in the US. Many more people can telework in the US compared to Colombia. And if we were to plot Peru, Bolivia, Brazil, any other country, and we were to use not the US, but some country in Europe, you will see the same situation. So just to wrap up very quickly, what that implies is a much harder or much higher exposure in our countries as compared to others. So here what you have is, by these accounts, something close to between 50 and 60% of jobs in Latin America are directly exposed because they are in non-essential sectors or sectors that cannot telework within those non-essential sectors. If we run a counterfactual where we impose the economic US structure rather than the Colombian structure on the Colombian data, then that exposure will fall very, very markedly. So the basic message that I just want to place here is how much more exposed we are to especially lockdowns and demand shocks. This chart shows that the effects of only the demand shock is much less stringent than that of the lockdowns. So with that basic message, I'll stop and leave the rest for our posterior discussion.
Thank you, Marcela. And I should have said more explicitly, all of our scholars here are experts in their countries, but they are also keen observers of the whole region of Latin America, because I said you were going to talk about Colombia specifically. Your work is actually about the whole region. And the same thing I could say, Julio moves from the very specific work in Sao Paulo all the way to concerns about the region as a whole and Brazil as a whole. And next we have Nora Lustig. Nora, please.
Okay, well, let me also start by thanking the King Center, Alberto, for inviting me. It's a pleasure to be here with you, even though it'd be more pleasurable if we did it in person, I'm sure. And what I'm going to do actually is something that is sharing with you some results of work that we're doing with two of my graduate students and a colleague at the Commitment to Equity Center and Institute. And it's based on this paper, which is hopefully going to come out later this month, in which you'll be able to see all the details more carefully. And essentially what we've done is we have microsimulated the effect of losses of income on households based primarily on which sector the head of household is working in, and following a bit the sort of same type of classification that Marcela alluded to, but perhaps with less granularity. And we did that for so far for 4 countries. We'll have also Central American countries soon, so we'll be able to see this in more and more places in the region. And the key questions that we're asking is what are the potential, because we're not measuring actual outcomes yet, of confinement policies on poverty, inequality, and mobility, and extent to which safety nets are offsetting the negative effects. And we're going to look at the incidence of poverty and the Gini coefficient for inequality and poverty variables, and some of the safety nets that have been implemented. We don't have them all yet. And different from what a lot of people are doing, I think what's new is we're also looking at mobility variables. Mobility ex ante ex post, not over time. But it's very important to see what happens to people, particularly people who are in the middle class and fall into poverty. Is this a permanent trap, or will they be able to come back? So how much can we expect the middle class to self-insure and actually come back from a situation in which maybe currently they're put below the poverty line? These are 4 graphs with a pre-crisis composition of income for the 4 countries. In the case of Argentina, it covers about 62% of the population. The surveys are not national. In Argentina, they're mainly urban. The vertical lines, the first vertical lines is the international $550 a day in purchasing power parity, so it's comparable across country. The second line, the one that's further to the right, corresponds to the national poverty lines. And you see that they fall in different places, obviously depending on income per capita, and also the fact that Argentina is only urban, and we know that a lot of the poverty happens in rural areas, is not strictly comparable. And this is very important because it's telling you something already about the region. The orange is incomes that come from cash transfers, and we can see that they provide a floor, particularly to the bottom. This will be linked to the question that you have later on for us. The second one, the gray, are contributory pensions of the Social Security system. They are very important in Argentina, also in Brazil. almost nil in the case of Mexico, and in between in Colombia. Public employment is the light blue. The green is the private sector incomes that are not at risk, and the blue are the incomes that are at risk. And I guess one thing that we can see immediately from these graphs is that at-risk income spans the entire distribution. It's not just concentrated in one place in principle. These are the safety nets that we're simulating, the ones that are in orange, but I'm just showing them. And here I'm going to show you very quickly some of the results about poverty. And the way we do the microsimulations is we take the total contraction in GDP that's been forecasted by the IMF in its last WEO, World Economic Outlook, for each country, and we take that as the aggregate fall. And you can have different combinations of households, percentage of households that lose income, and the percent of income that they lose to give you that same total. So you can have fewer households. By fewer, I mean 30 or 40% of those with at-risk income may lose close to about 80, 90% of their income versus the opposite. So this is when fewer households, 30 to 40% of the households that have at-risk income, lose about 80, 90% depending on the country. What happens to poverty and inequality, both with the national poverty line and the 550 poverty line? Poverty increases, as we would expect. And if we can think about, so what does it mean in terms of how much poverty progress have we lost due to the shock potentially? This is potential. I'm not saying that it's actually happened or it's going to happen exactly like this. It's about 10 years. A decade of progress is lost by this. And something similar happens with inequality. Interestingly, if you are in the scenario in which people would lose less, more households lose less. Turns out, oops, sorry, this is going too fast. I'm not showing this here. The results would be less drastic for inequality because you have fewer people who have close to zero income. And for poverty, it depends because it depends on the distribution around the poverty line. In the case of Brazil, when you are looking at the scenario in which less households, more households are losing less income, interestingly, with the lower poverty line, poverty declines. And the same thing for inequality. And if we hadn't heard that Getulio Vargas and people in IPEA have found the same thing, we would have said, this is crazy. But apparently, the results in Brazil are that the safety nets have been so generous that actually people may be doing better than they did before the crisis. I wonder what Julio thinks about that. But that's been, told by Sergei Suarez, and some of the leading scholars in Brazil are saying that that is a possibility. Okay, so what about mobility? I mean, one thing is what happens to these indicators of poverty and inequality, but what happens to people in terms of where they were before the pandemic shock and after? And I think we find an interesting result here. I'm showing always with the safety nets. I think that's what's interesting. So already the mitigation policies are taking into account in everything that I'm showing you. And depending again on the scenario, if you have fewer households who lose more income, then there's going to be more people from the middle class who are falling below the poverty line. And what we see is that in the case of Argentina and Brazil and Colombia, this can range between 20, 25% of middle class people who may fall below the poverty line. I say fall below the poverty line, not necessarily becoming poor, because they're not necessarily permanently poor. It's a shock that may be a one time and they may be able to self-insure. So the question is, to what extent can they self-insure? Meaning, do they have savings? What do we know about them? We don't know if they have savings, by the way. In the surveys, that's not captured, or not captured well. So we decided to look at the composition of education of the losers that were in the middle class, either the lower middle class or the middle and upper middle class. How many of them had more than, for example, completed secondary education, assuming that those households where the head had more than secondary education probably can self-insure, probably have savings, and probably can come back more easily. And here is what we see. So you have about 50%, between 40, 50%, depending on the country, of the middle classes that will be, in principle, we assume, be able to self-insure and also be able to come back if, once the situation reverses itself much more easily than those who have much lower levels of education. So that means that we still have an important portion of the middle classes, those that are on this part of the distribution, that may have a hard time getting out from a situation that was not necessarily temporary, because they may not have had as much savings, and they may not be able to reinsert themselves in the labor market as easily, because maybe they're owners of these small enterprises that Marcela was referring to, many of whom probably will be permanently bankrupt. So that's what I wanted to share with you, and thank you for the moment, and I'm ready for the Q&A.
Thank you very much, Nora. You can see that we have a sobering perspective from our three panelists. There's a lot of questions that have started coming in. Also, we have some questions that were given to us in the registration stage. So I will kick off with a couple of questions that come from some of you that sent them earlier, and then we'll go into the chat. I should point out on the Q&A, Julio is already answering away some of the questions that are coming in. There's just a wealth of discussion going on there, so you can multitask. I don't know if I can, but there are things going on the side. But let me start with a question for both Marcela and Nora. It's actually two questions, and I'm letting you kind of share them or answer them in whichever way you want. There was a concern about how the pandemic looks in rural versus urban areas. So I think that shows up a little bit also in what Julio showed us in the Brazilian data. And I would say that there is always this concern about whether, we are really concentrating our attention on things that are not necessarily the visible ones. How much underreporting might we actually be observing in the data we have about what's going on in rural areas. And I would also add to that this component that has been coming out in the Q&A about indigenous or Afro-Colombian, some of the minority populations in the region. So if you had any thoughts on that. And the second question, which also comes from the previous question, is a question about, is this the time for universal basic income? Is this the way to go? Or Marcela, should we be thinking about supporting small business and firms rather than households? So I let you go ahead with this just to get us started.
Who do you want to go first?
Nora, go.
You want me to go first? Okay. Well, let me say, first of all, that I have not studied the differences between rural and urban areas. So this is very conjectural at this point. What we've seen in some cases is that, at least for the time being, the epidemic has been more slowly getting into the rural areas than the way the urban areas have hit. But that doesn't mean this will happen in the future. As we've seen, this is a movie that starts at different points in time in different places. So we still don't know how hard rural areas will be hit. Probably those which are exposed to migrants are going to be hit sooner and faster. Now, in terms of the economic shock, one thing that happens often during at least past economic crises is that the rural areas become a cushion, especially for the very poor small producers who have at least some land that can be used to feed themselves or to partially feed themselves. You have a reverse migration to rural areas in past crises. And from the Mexican crisis, which I studied a lot in the 1980s, actually rural households' income contracted by far less than urban incomes, in part because you have one part of the sector that was not part of the market system. There was still a lot of own production for consumption that was going on. But we would need to see to what extent, given that so many years have elapsed since then, the sort of non-market section of the rural economy is present in the context of current Latin America. So my conjecture is that it's probably going to be less severe, but the poor in rural areas are often much poorer than their urban counterparts in living standards, even if you correct for some things like the differences in cost of living. And so smaller reductions may mean devastation. So we have to be very careful about being happy about that, because it could be that it results in a sharp increase in dire poverty in some rural areas. So let me stop that with rural. You want me to talk about the UBI immediately, or you want to have this?
I'm muted. Let me have Marcela chime in, and then we could go back to you if you want.
Well, very shortly, I also have not directly studied the differences between rural and urban areas, but there are things that are becoming obvious. One Nora pointed at is the kind of activity that goes on in rural areas is essential, has been protected, and so in that sense, it is less subject to some of the shocks I had talked about. On the other hand, the social consequences of the crisis may be hitting very hard the rural areas in a few sectors that are particularly worried about, but not sectors, segments. One that I would want to bring into attention is children. Our school systems are closed, and that means students are going through virtual and remote education. What that means in rural areas is basically children are off school without their education, without seeing their friends and socializing in an environment where they are sparsely located. And so I'm very concerned about the long-term consequences on human talent and on the social skills and general skills of children in the rural areas. The other social area where the rural are in great danger is that of health attention, because of both behavioral changes that make people be wary of going to get health help, and because of the restrictions to mobility, people in the rural areas are getting less attention than they should. And so I think those are two consequences that we must be particularly wary of. And I think governments must carefully balance those restrictions for rural areas. By construction, people in rural areas are more socially distanced. And so whether it makes sense to close schools in those areas, especially when research seems to be finding that children in school are not at great danger, given those conditions, then it looks to me that schools in rural areas should be opened immediately so children can get back to their education. And something similar can be said about health attention in rural areas.
You want to give us your thoughts on universal basic income, Marcela?
Cool. So I think that's one of the most interesting debates that this has brought to the forefront. This epidemic in Latin America has brought to our attention something we knew, but was not so evident, and it was the lack of a true social protection. So the poorest in the region were suddenly left without their income, and there was nothing for them. And so very quickly, governments also showed us something we didn't know, which is we did have the capacity to rapidly enroll these systems that Nora showed the numbers for, to start getting to those people. And so I think the combination of both things, how incredibly visible it was that some people had no social insurance to start with, and how rapidly the governments could get that in place, led to this debate that I think is very interesting. Just to give you to go to the point, I think it is not the time for UBI, in the sense that I don't see an immediate way to enroll a proper UBI, by you understanding it, understood as everybody gets something. And I think that there's a very hard political and ethical debate about giving money to the rich that that is the greatest obstacle for UBI. On the other hand, I think this raises the other possibility, which is not UBI, but guaranteed basic income for the vulnerable. That is to say, a transfer that goes to everyone that is poor or vulnerable, defined in some way. In my opinion, this may be the time to do that, but you cannot simply jump to the floor and say, hey, I'm going to give you this transfer. There's no money for that. Fiscal resources are just insufficient for that. And so if you were to do something like that, then what you need is a host of reforms, in my opinion, that need to bring together this potential guaranteed basic income with a tax reform that allows for a truly for true redistribution. That is to say, that taxes more heavily the richer people in the region. Taxes to personal taxes as compared to corporate taxes are lower compared to advanced economies. And it is also the case that taxes on capital rents are lower. And so that's one fiscal space that we seem to have. Then if you do that, the other reform that you can bring together is something that gives more flexibility to the labor market. We have very high, in many of the countries in the region, not all of them, we have very high taxes on employment. Many of them are just trying to insure the people. And if you have this other system, maybe you need a little less of that other thing. For instance, in the case of Colombia, where the minimum wage is very high, then something like a guaranteed basic income could be a way to open the door for a different way to protect incomes without that very high minimum wage. So I'll stop there.
Nora, I know you have been working on this for the last few years, so please tell us your thoughts on this.
Well, yeah. First of all, let me re-emphasize a couple of things that also Marcela said about the rural areas, that we have to be careful. One is the fact that if the infection reaches the rural areas, then the ability to cope with it is much lower from the medical point of view, from the epidemiological point of view, per se, because of the fragility of the health systems. And that's very important to bear in mind as we see how the pandemic evolves. And the second thing that Marcela mentioned, which is lack of access to education during the school closures and other reasons that are affecting education now, is going to have, and not only for rural areas, but for the poor in the urban areas, a lasting effect. I mean, we talked about the impact on inequality now in the short term in what I showed, but I think we have to be very concerned about the impacts of this pandemic on the human capital of today's children, because both nutrition and education are probably going to suffer significant negative shocks, which will impact inequality in the future. We are seeding this, so we're sowing the seeds for more inequality in the future if we do not protect today's human capital. So I'm going to leave it at that. So do you protect it with a universal basic income? Probably not. I agree with Marcela that when people talk about universal basic income, by the way, they often talk about things that are not universal. So once you start scrapping behind the proposals, it's usually more categorical type of transfers that try to deal with large groups of people, like the elderly, families that are the single-headed households, children. And in that sense, one thing that I do think that probably we cannot do during the pandemic is fine targeting. So we do have to move in the direction of a minimum guaranteed income. I think the right, by the way, is not to an income, but to not to have an income, everybody have an income, but everybody have a basic income. So people who don't need it, you don't want to spend resources there. And you might as well use those resources that you save from not giving a transfer to those who don't need it to protect the human capital of those at the bottom. We are going to be living through very stringent fiscal times. Even if we introduce reforms of the kind that I'm all in favor, that Marcela mentioned, which is more progressive tax systems, the fiscal space that you're going to be generating, especially given that countries now are increasing the amount of debt, might be small, may not be giving you that much if you want an ability to introduce very ambitious social protection schemes So you will have to choose. And in the choice, I think that we have to continue thinking about the poor need to go first. And then you also want to be able to provide the middle classes an ability for them to become as resilient as possible. So not through a UBI, but you need systems in which you can guarantee access to certain income. You use the resources that you would spend on giving a transfer to the rich that they don't need it, or the middle class that didn't lose their income, they don't need it either, and use those resources to protect not just the incomes of the poor, but also the human capital of the children of the poor.
Thank you, Nora.
I think a very
Julio.
brief comment.
Yes, please.
The President Bolsonaro don't conduct very well the pandemic in Brazil, but he make a good thing. He have implement a cash transfer, emergency cash transfer that cover 25% of the population with more than $100. It's 3 times more than Bolsa Familia. It's a large program. It's very expensive, but he supported this. This is one thing that at least in this aspect in Brazil, you have a good news.
So Julio, thank you for giving us the data. And I think what Nora showed in her graphs suggests that in a way, the poverty gap, I mean, scholars have been talking about it, that the poverty gap is not as big as we think it is, no? That there's enough money if you can just target it and find a way to put it in the right hands. Julio, there are a bunch of questions about Bolsonaro that you have been graciously answering, but I do want to ask you about something which is really in your area of expertise, which has to do with the excess mortality, the comorbidities, all the other diseases, So what's going on in the favelas, in some of the other regions, in some of the more vulnerable places, in terms of cancer, drug delivery, dialysis, declining vector control for dengue, all these problems. And even there's a question in the chat about TB, which you have worked quite extensively on. So we wonder if you could give us a little bit of insight into what's going on with the rest of the health challenges.
The COVID in Brazil affected the poor population more than the rich one, and especially in poor community. And not only related to the health, it has several surveys that show the prevalence in the poor communities, the double of in the rich community. And the disease related to the poverty, it's very common in Brazil, especially tuberculosis that I already worked. And you saw a decrease in 40% of diagnosis of TB in the last month. It's a huge impact and probably reflect in the number of deaths in the future. You have some HIV patients have some report that have problem to deliver the medications for HIV patients. And for vector control, especially for dengue, you have now a huge epidemic in Brazil, especially in the Middle East. And the primary care health don't able to visit the houses to make the control and to check the vector. And I probably don't see the impact now, but in the future, you have more data about how this disease probably increase, and this balance probably it's become more worse for poor population because they support, but by SUS, your unified health system, and the majority of the effort now in Brazil is concentrated for COVID-19. And all the prevention work that was done by diabetes, hypertension in primary care was closed. And I think you have a big problem in the future in Brazil, especially with this prevent disease.
Thank you, Julio. So I should point out to our audience that one of the things that I had not appreciated until now is how strong some of the Latin American institutions actually are. Things like SUS that you just mentioned, probably one of the most extensive health systems in the world that is very unique in its combination of private versus public. The response to putting in place transfers very, very quickly. So I think these are things we should really work on to understand much better. There is not a lot of time, but we have a series of questions which I will just throw to the three of you a little bit. There is a series of questions about remittances. And I think more generally, I think there is in a way an underlying question about, the role of these countries in Latin America that we might not be centering on right now, but let's say Central American countries that really depend on remittances as a very important part of their buffering of income shocks. So if you have any thoughts on those, I would appreciate if any of you wants to take a question about that. And then there is a second series of questions which I think they're very they're very difficult to answer, I think, but they have to do with the question of how do we really, this question of education, I think that people have already highlighted. How do we really create the conditions for bringing a human capital reinforcement in the region? If I may ask those two. Nora, you want to?
The first question, I apologize. I was answering people in the chat, so I didn't hear it. But for education, I think that one of the things that we have discovered very sharply is that in the various divides, brutal inequalities that the COVID-19 has revealed, is those who have access to connectivity and those who don't. And it seems that for inclusion, connectivity has become a major component in terms of strategies of where governments should actually invest resources. They affect access to education. They also affect the ability to actually do things online and not being exposed to contagion. If you can do banking online, if you can receive payments online. So connectivity for me became like one of the first things that I would have advised the government to say, how you make sure that, first of all, if you're going to have distance learning, are people going to be able to do it? Do they have the internet connection or alternatives like with data? Can you find ways in which the private companies can actually donate now, the telephone companies, to help bridge the gap quickly, because we had an emergency as well. It's not only investment in the future. So that's one element. The other one that I think is very important is that there's another huge divide is, between the children who have parents who are educated and, spend time mentoring them and being coaches during the process of learning at home, and those who may not have parents or have parents with low education, or may have parents that still have to cannot work at home, so they cannot really be there for them. So you need to have a mentoring system that will help those who are not lucky enough to have the luxury parents that many of the middle class, upper middle class, and rich kids have in our region, to make sure that they do have access to support during the process of trying to learn, not in the classroom. And I think that one could think of, I don't have time to go into it, but there are innovations that you could implement there that might be useful to think about on how to bridge the gap of not having, if you want, parents with at least secondary or more education completed at home.
Marcela, do you have some thoughts?
So just very quickly on, I agree completely with Nora. My hunch is that the only way to make sure that children in rural areas get the proper attention is not connectivity, precisely because of Nora's second point. You may have a very nice computer, but if your teacher and your parents are not able to guide you with that, there's nothing you can do about it. So I keep on the impression that children need to go back to school. I do, of course, understand the concerns that people have raised, say, in the chat about the possible contagion that may arise with children as vectors. The research that I've seen is also pointing at the fact that children seem to be less of a vector than older people are, but there are studies that are a bit contradictory of that particular finding. But do keep in mind that even if children infect their parents at home in a rural environment, those parents interact less with other people in rural areas. So that I was referring to the fact that there is social distancing by construction in the rural areas. Let me take the opportunity, however, to change a little bit gears because I never answered your question in the first round about businesses and help to businesses versus help to people. So my preferred combination is you do need transfers for poorer people, and especially people who are informal. I agree with Nora that has to ensure not an income, but a basic income. So that means only people who are at a given point in time not receiving that amount will receive some complement to that, not simply a given amount from the government, and that eases the fiscal pressure and also bad incentives. But that has to be accompanied with a way to protect businesses. Those may be, say, subsidies to payrolls. It has been implemented, but two concerns or three concerns. One is fiscal sustainability of that. For how long can we go doing that? Two is bureaucratic. Their take up seems to have been much lower than we expected. That is to say, not that many businesses are really getting those transfers. And I am convinced that partly that's because of bureaucratic hurdles and the difficulty of literally giving that money to businesses. And the third concern is that if you impose on businesses an infinitely large effect, then you cannot simply come in and mitigate that thing with an equally large infinite transfer. So that's simply not possible. With that in mind, I do keep on thinking that it is crucial the governments in the region think more creatively and comprehensively of the set of problems that they have in hand. You showed us, Alberto, that many countries in the region have been up there in the top of the stringency of measures. We are a region that has many countries that have been in lockdown since March nonstop to today, and those are blanket lockdowns in many places. And those regions started there, and they only started going up the epidemiological curve in the last month. So you spent 4 months with very stringent measures that impose very harsh social consequences without the going through the epidemiological curve, and therefore you're not reaching a plateau. You started too late compared to when you started the measures. So I do think that these countries need to start thinking about how to get off these lockdowns. There's no exit strategy that has been seriously considered, in my opinion, and I think that's an urgent thing, both to be enacted and to be announced so that people and businesses can make decisions based on the expectation that this is not a permanent situation.
So I have to be mindful of time, and I want Julio then to have a last word. I do want to shoot at you one question that is in the chat at the very end, which is a question about the value of life. You know, is it the case that some lives are worth more than others? I think this is particularly pertinent for the way Bolsonaro initially reacted to the pandemic. So I'm sorry, Julio, to put you on the spot on that one, but if you have some closing thoughts on this.
No problem, Alberto. For me, it's a pleasure. Here in Brazil, it's like the majority of the poor people need to continue to work, especially in the poor community. They can't stay in your home. It's very difficult to give this message, especially when you have in the central level, the president say the another thing. You need to go out. You can't break the economy. You need to continue to work. This little flu pass in every country, and you need to continue to do your normal life. This is the key message for the central level. But when you see the data about the cases and the deaths, the majority of the cases and the deaths relates to the poor population, to the Black people and the indigenous. And when you ask me the value of the life, maybe this is the answer. The rich people have private health system. They have more ICU beds. have more support, income support to stay in home. And the poor people, the majority, need to work. The president have forced this information. They get infected and probably all the data in the entire big cities show this. Have more risk to acquire disease and more risk to deaths, the poor and the Black people.
So I have to close our event now, but I do want to say something that appears in the Q&A where people are asking whether we will continue doing series on this. I think on behalf of both the King Center as well as the Center for Latin American Studies here at Stanford, I think we're very committed to making sure that we continue these conversations, that we also focus attention in regions like Central America, the Caribbean, the Andean region, places we have not been able to touch upon today, but I do want to make like a public commitment that we are trying to, contribute to the discussion. I also want to thank Leslie Murray and Jessica Leno and Elizabeth Sainz at the Center for Latin American Studies and the King Center on Global Development. And a final thing is just to tell everyone, please wear face masks. This is the one thing we know that seems to make a difference, that it is an intervention, that we have something going for it. So please keep that in mind as you go around protecting yourself, protecting your loved ones, but particularly protecting those who are more vulnerable than you are. Thank you very much.